All right, ladies, don't put down that coffee.
Ooh,
you don't have to tell me twice.
we're listening.
Right? So a new study shows that caffeine could actually help you live longer and healthier lives.
I like the sound of this. Here to talk more about the study is our health expert, Dr. Payal Kohli. Dr. Kohli, thank you for joining us this morning.
So excited to see the study.
Us morning folks are really excited. Something positive coming from coffee. So let's talk about what was found in the study, and was it the caffeine that was actually beneficial?
Yeah, so it was a nurses' health study. So it looked at a bunch of nurses, and this looked specifically at nurses in their 50s who drank 1 to 3 cups of coffee a day, and then followed them out for 30 years.
Whoa. Wow.
Yeah, and what they found is that women who did that actually 30 years later were more likely to be free of disease, mental disease, physical disease, and just to be healthier overall. But here's what's interesting. It had to be caffeinated coffee. If you drank decaf coffee, it didn't have the same effect. If you drank tea, it didn't have the same effect. And if you drank sodas, it was actually worse.
Wow.
Okay, asking for a friend.
Yeah.
If you put some creamer in it, does it still have the same benefits?
So probably a tiny bit of creamer in your caffeinated coffee is okay.
Okay.
What you don't want to do is to do those sugary coffee drinks.
Okay.
Because that is going to give you a ton of sugar and other things as well. And what you also don't want to do is to have too much. So 1 to 3 cups is sort of your sweet spot. If you start to have too much, it can actually affect you adversely, because women, believe it or not, the estrogen changes the metabolism of the coffee.
Oh, interesting.
So if we're on birth control pills, twice as much caffeine comes from the same cup of coffee, because it prevents the caffeine from breaking down in our body. During our menstrual cycle, we're actually more sensitive to caffeine for the same reasons, because that estrogen spike. And then during pregnancy, you're significantly more sensitive to it. After menopause, you become less sensitive to it in general.
It seems like caffeine is good for a lot of reasons. Like we've talked about it for dementia and Alzheimer's as well. What are the known benefits of having caffeine?
Yeah, so it's not so much the caffeine, although it might be some caffeine, but also the coffee itself. So we think the antioxidants in the coffee can help to sort of balance out the inflammation. The caffeine can boost our metabolism a little bit, which makes us more efficient, which makes our brain cells work better. It makes all
Boost
the
that
functions
metabolism.
work better. And then heart disease as well. So type 2 diabetes, stroke, conditions like Alzheimer's, as you said, neurodegenerative conditions, even potentially a little bit of a balance, but anxiety and depression lower. But if you have too much, then you can imagine the coffee can be stimulating and actually cause palpitations, a little bit more anxiety.
You want to find that sweet spot, not too much.
No pun intended.
Literally. You touched on this a bit, but anything more regarding caffeine and estrogen that we do need to know about?
So I would say when you are having your period, if you're a woman taking birth control, if you're pregnant or you're postmenopausal, you need to actually tweak your caffeine intake according to what part of your cycle you're in or what you're doing. You need to look at your breasts as well, because estrogen can also cause the breasts to be more sensitive to the effects of caffeine, specifically fibrocystic changes. So women can have more tenderness in the breast, they can have more irritability, and their sleep can get more disrupted if they keep drinking the same amount of caffeine even during their menstrual cycle. So at the peak of your menstrual cycle, you probably want to dial back that caffeine just a little bit. And if you're someone who takes birth control, then keep that in mind as well.
Good to know.
So there are people in the world, it's shocking, that don't drink coffee. I don't know how they do that, but if someone's like, I don't drink coffee, should I start drinking coffee? What would you say?
I would say no, because this study is what's called observational, which means that we looked at 2 different things and saw how they correlated. It's not causal. We didn't say you drink coffee, you don't drink coffee, controlling for everything else, and then looked at the outcomes. We just let women do what they want. So is it possible that the women who drink 1 to 3 cups of coffee a day are also doing other healthy behaviors? And it's not the coffee, but it's their other healthy behaviors. Now, the authors of the study tried to control for this statistically by doing adjustments and things like that, but you can't capture everything. So, coffee is good for you in moderation. You need to watch out for your bone health and for all the other things that we discussed. But if you're someone who doesn't drink coffee, you don't need to start drinking it because of the study.
Anyone in particular that should really be watching their coffee intake, that it could be a little bit more on the harmful side?
So definitely if you're pregnant, I would say, because both for you and for baby, risk of miscarriages and such, especially with that metabolism issue we talked about, more caffeine being in your bloodstream when you drink that. If you're someone who has osteoporosis, you might want to talk to your doctor, or you might want to add calcium to your coffee, drink it in milk. not cream, but milk, to try to get some of that calcium intake as well, because coffee in excess doses and the caffeine can actually worsen osteoporosis as well. And then from my perspective, my heart patients that get arrhythmias and such, sometimes I tell them to do, even though the study was a caffeinated coffee, I tell them to do half decaf or do decaf all the way, because that dose of caffeine is really important to keep under 200 milligrams a day, which is about a cup and a half of coffee. I know you guys probably go more than that, but
I'm on 1.5 today.
Cheers.
Cheers. Thank you.
Yes.
Overall, I feel like that was positive for us.
I agree.
Yeah.
I agree. Well, interesting study.
Yes.
Dr. Kohli, thank you so much for
Thank
coming
you.
in. Appreciate it. You can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.